This study is very big to my heart. Did I just turn on? You can hear me? Okay. I call this case the Miracle Man, and you all will understand once I go through it. It isn't a concussion case, and it isn't a workers' comp case, but it easily could be. In Florida, under the Florida Statute 11218, the Heart and Lung Bill, certain public safety workers, firefighters, law enforcement officers, correctional officers, and some EMTs are given a legal presumption that heart disease and hypertension are work-related. So when one of those workers suffers a heart attack or a cardiac arrest, it's generally presumed to be a workers' comp case. And when the heart stops, the issue doesn't stay in the heart. The brain immediately becomes part of the story. Because when blood flow drops, oxygen to the brain drops too. So what starts as a cardiac case can quickly become something else. It becomes a brain recovery case too. The patient is a 62-year-old man who is doing something that many of us try to do to stay healthy. He was working out at the gym. What happened next changed everything. After finishing his workout, the patient suddenly collapsed. A member of the gym found him on the floor and immediately started CPR while someone else called 911. Within minutes, 3 gym members were taking turns doing chest compressions. When the first police officer arrived, he jumped in and continued the CPR. They also used gym AED, the automatic external defibrillator, trying to restart the patient's heart, but his pulse didn't come back. When the EMTs arrived, they continued aggressive resuscitation. My tongue is getting dry. Okay, they delivered 2 rounds of what was dual sequential defibrillation. I'm having a problem here with this. Which is essentially 2 defibrillators delivering shocks in coordinated attempt to restart the heart when standard shocks don't work. After 46 minutes, they finally detected a faint pulse. The patient was rushed to Cleveland Clinic's emergency department, but even during the transport, medical team had to continue CPR and advance life support. Doctors administered T&K, a clot-busting medication used during severe heart attacks. From that moment, the patient collapsed until he was finally stabilized. 1 hour and 52 minutes had passed. Doctors determined the patient had suffered an acute inferior STEMI, a severe type of heart attack. They found an 85% blockage in his right coronary artery. He was immediately taken for PCI, where doctors placed 1 drug-evaluating stent to reopen the artery and restore blood flow in the heart. But the crisis wasn't over. The patient was admitted to the medical intensive care unit, where his condition became extremely unstable. His blood pressure dropped dangerously low and he developed cardiogenic shock, meaning his heart could no longer pump enough blood to support the body. He became unresponsive. Doctors inserted a femoral intra-aortic balloon pump to help his heart circulate the blood. Soon after, he was transferred to the surgical ICU, where the condition worsened again. Within 12 hours, the doctors had to place him on a VA ECMO. ECMO is essentially a machine that temporarily takes over the work of both the heart and lungs, circulating oxygen and blood throughout the body while the organs could not do it themselves. During this period, the patient experienced a number of life-threatening complications. A right hemothorax, a right chest tube placement was to drain that, acute kidney injury, acute blood loss anemia, acute metabolic encephalopathy, acute hypoxemic respiratory failure, where oxygen levels in the blood were dangerously low. The CPR that saved his life also came with consequences. The patient suffered 12 broken ribs and a pneumothorax, collapsed lung from the force of the chest compressions. The patient remained critically ill for 5 days, hemodialysis for 6 days, and then intra-aortic pump for 7 days. During this time, the doctors also ran a continuous EEG, monitoring his brain activity because they were concerned about possible brain injury from the long period without adequate oxygen. The patient was finally taking the tube out, and he woke up, and the first thing he did was start asking about his family. He wanted to know everyone, how everyone was, especially his kids. He recognized most people by their faces, but sometimes struggled to recall their names. In a very human moment, after everything his body's been through, he asked for a Coca-Cola. Once the sedation cleared and the patient began interacting more, the neurological effects of the event became more noticeable. After such a long, prolonged cardiac arrest, the patient had sustained an anoxic brain injury, meaning parts of the brain were temporarily deprived of oxygen. The patient experienced confusion, anxiety, memory lapses, difficulty recalling personal information like his birthday, phone numbers, and address. Interestingly, he still recognized the family and friends both by face and names. His long-term memory was largely intact, but short-term memory was significantly impaired. Family members began noticing other changes too. The patient was answering questions with very short one-word responses, which completely unlike his normal communication style. He struggled to remember things that had just happened minutes earlier. Because of the swelling concerns after his prolonged intubation, he was initially limited to thickened liquids until a swallow study came and confirmed it was safe for him to drink normally. On day 7, doctors were able to remove the balloon. And for the first time since his collapse, the patient was no longer dependent on mechanical circulatory support. From there on, he slowly began physical therapy and OT. After 14 days at Cleveland Clinic, the patient was stable enough to be transferred to Memorial Rehab Institute for intensive rehabilitation. He left the hospital wearing a life vest, a wearable defibrillator used to monitor and protect patients high risk for dangerous heart rhythms. At Memorial Rehab Institute, therapists observed more cognitive challenge, difficulty reading, even though the patient had always been an avid reader, trouble concentrating, problems with problem solving and sequencing, difficulty following even 1-2-step instructions. Doctors explained it to the patient and his family that these kinds of deficits are common after a prolonged cardiac arrest and oxygen deprivation. But they also made it clear time would be determined how good the recovery was possible. The patient spent 14 days at Memorial Rehab Institution working on physical and cognitive recovery. After discharge, his rehabilitation continued through several outpatient programs, Memorial Outpatient Neuro Rehab and Memorial Hospital West Cardiac Rehab. During this time, the patient also was forced with other medical complications. His blood pressure was unstable and remained hypotensive for nearly 2 months while doctors worked to adjust the medication. 2 weeks after discharge, on March 29th, the patient had to be readmitted because fluids had built up around his lungs. Doctors performed 2 thoracentesis, draining over 1.6 liters of fluid from his right lung. Another complication came from the ECMO procedure. That had caused a 5-branch brachial plexus injury in the patient's right arm that he used dominantly. Resulted in severe swelling, nerve damage, loss of sensation, neuropathy, weakness, and pain. And he was right-handed. By the time the patient returned home, he was extremely weak and deconditioned. He needed help with basic activities, dressing, bathing, toilet, walking. He required a walker to get around, and it was significant shortness of breath. And short-term memory deficits were still severe, and he required supervision throughout the day. Driving was not possible. Before this event, the patient had been a C-level insurance executive. managing complex responsibilities, and making high-level decisions. Now, even routine tasks were difficult. Despite everything his body's been through, the patient began to make steady physical progress. With cardiac rehab and physical therapy improved enough by April 25th, he was walking independently and was able to perform most daily activities. And one of the most meaningful milestones of his recovery, the patient was able to walk his daughter down the aisle and dance the first dance at her wedding. Physically, he was improving. Cognitively, however, the deficits remained clear. Prior to starting the treatment at Focus Brain Therapy on May 8th, 2025, he was what clinicians sometimes call a walkie-talkie. A patient, someone who appears physically functional but has a significant cognitive impairment. He struggled with communication, problem solving, insight processing speed, executive functioning. These changes also led to depression and anxiety, especially when he began to understand his brain wasn't functioning. For someone used to leading organizations and solving complex problems, that uncertainty was frightening. After several weeks at Focus Brain Therapy program, the patient began to see improvements in both cognitive and physical and performance. He regained enough confidence to attempt returning to work and began using the computer again. But after 3 weeks back at full-time work, patient realized something important. He could tell that his cognitive abilities had changed, and that he recognized that he could not yet perform his executive responsibility at the level his role required. So he made the difficult decision to take a leave of absence and transition to short-term disability. But progress didn't stop. Week by week, the intensity and the structure of the program helped the patient rebuild important cognitive functions, gradually experience improvement in memory, processing speed, coordination, stamina, and confidence. By the end of June, the patient reached another milestone. He's driving again. He could remember directions, navigate locations, and manage the physical and mental demands of daily life. He continued cardiac rehabilitation until mid-July, when he was discharged and able to return exercising at his community gym. Today, the patient continues to make steady improvements each week. His memory recall is stronger, his processing speed continues to improve, his confidence is returning, and he now plans to return to work into the insurance industry within the next several months. His family credits most of the progress to the support and structure of the Focus Brain Therapy program, which has helped him rebuild not only cognitive function, but confidence in his future. And the patient's case, both of these things were equally important. Focus Brain Therapy didn't just help the patient recover his skills, it helped him get his life back and believe that he can live a long, fulfilling life after surviving what nearly took his life. And here is his results over everything. So, pretty miraculous, huh? Would you guys like to meet this miracle man? He's part of our family, the workers' comp family. Let me introduce Matt Kerman. Karen's husband.
Thank you. Love and support. To say that I've been through a lot is probably the understatement of the year, right? February 15th was a life-changing event for me. Through the love and support of my wife, my family, I've made significant improvement. I was able to walk my daughter Avery down the aisle for a wedding, which was something that I was going to do. Even if I had to crawl, I was going to do that. Yeah. However, during that time, as Lisa said, I started to notice that things just weren't right from a cognitive standpoint. You know, I've always been a pretty prolific reader, and I would try to read, and something just wasn't right. And so I would talk to Karen about this and tell her what I was feeling and experiencing. And of course, that created its own emotional stress for me as well, because I really started to realize that something just wasn't right. I had a difficulty reading, concentrating, processing information, and so that became a real significant factor in my overall recovery. Physically, I recovered rather quickly from the heart attack and the anoxic brain injury, if you would. I still have some challenges with coordination, but that seems to be improving on a daily basis. During that time, my wife and I were introduced and met Lisa and her team at Focus Brain Therapy. We really weren't familiar with the program. Lisa and her team took us through, we did a tour, we went through the cognitive circuit training program, and decided that this was going to be the right step for us in terms of my recovery. And initially, when I started, it was hard, because as I went through that circuit training, it was just another constant reminder that I had suffered a moderate brain injury, and I just wasn't able to do the things that I did prior to the heart attack. But through a lot of hard work, love, great trainers and therapists at the program, as you can see by the results of these tests, I've made a significant improvement, and I continue to do that. And I can't thank Lisa and her team enough for what they've done for me and for my family. And I do have plans to return to work. They may be a little bit aggressive, and sometimes I have to scale that back. That personality type, being A-type driver personality, I miss the daily routine and excitement of work, if you could call it that. So my recovery has been remarkable, and I say that with all modesty. I give all love and thanks to my Lord and Savior, my family, and my friends. I have a tremendous support system, but then Lisa and her team go right there, because without them, I wouldn't be able to stand here and talk like this. We've had some few emotional times, and particularly Lisa, but the entire team have been nothing but supportive, and the love that I feel when I go there, and how committed they are to my improvement. Makes it easy some days to wake up and say, I've got to go do this, versus just lying in bed and feeling sorry for myself, right? So I guess in closing, I would just say that without this cognitive training circuit program and all of the exercises that we go through, I wouldn't be able to have this discussion and stand before you today. So I can't thank Lisa and her team enough. My family, Karen, has just been an incredible support system for me, my entire family. And we celebrated my daughter's wedding last April, and then come June, we're going to be grandparents. Quite excited about that, because at the end of the day, my family is what's most important to me. And I want to be there for them, I want to support them, and while that support may look a little bit different going forward, it's still going to be as important as it was prior to my heart attack. Thank you very much.
Okay, I don't know, do we have time for questions? Yeah. Any questions? Anybody? Okay, it's lunchtime. Oh, hold on a second.
Christine, right behind you.